Welcome back to Twin Cities Live. We're going to thrive with Twin Cities Live now. Your oral health is an indicator of your overall well-being. It impacts your speaking, your eating, and for children, poor oral health has been linked to increased school absences and worse academic performances. I've always thought it was sort of funny that like dental health was looked at as separate from the rest of your body.
Right.
Because turns out your mouth is in your body.
It is kind of connected to everything else. So get this. So each year, emergency dental care causes children to lose 34 million hours of school. Wow. That is bananas. So making those yearly appointments is absolutely important. So here to tell us how we can care for our children's dental health, we have Dr. Abbie Miller from United Healthcare. Hi, Doc.
Hi there.
I don't want to make light of this, but I will have to tell you this crazy situation that happened to me when I was in college.
Okay.
Now, not for younger kids. I know we're going to talk about younger kids. I had 12 cavities in one summer.
Oh my God.
12. Oh. Yes.
That's a lot.
I know.
Yeah.
It was very alarming, and I didn't even know I had them. I just went in for a checkup. They're like, you have 12 small cavities.
Oh my gosh. Wild.
So yes, I know that it's very important.
Yeah.
So it is pretty big numbers, though. I mean, you say here that half of children between 6 and 9 have had cavities in their teeth.
Yes.
That feels like a lot.
It does feel like a lot. Although, you know, for a lot of folks, making sure that we're following a healthy diet, you know, for a lot of kids. So some of it is if we're not brushing our teeth like we should, if we're kind of snacking between meals, sometimes that late at night snack, maybe after you brushed your teeth, having a little something with sugar in it, all of a sudden that's inviting in all the bacteria that then cause cavities.
Well, and I would think too, I mean, there's so much conversation about like the gut microbiome and how Americans really struggle with having a healthy gut microbiome. I mean, if you don't have healthy gut microbiome, you'd think your oral microbiome is probably in the same boat.
Yeah, I would think that's probably the case, but thinking just in general about oral health, things that we should be doing. So making sure we're brushing our teeth twice a day, and starting early with our kids. I think that's the other piece here, that a lot of people don't necessarily know how soon to start with oral health. So even before kids have teeth, you know, even our infants, we should be thinking about wiping their gums after they're eating, wiping their gums with a soft, clean washcloth. When they start to have teeth, then thinking about brushing. And when we talk about brushing, for a lot of folks, it's trying to figure out how long we should be brushing. So brushing for 2 minutes twice a day.
That's an eternity for a child, Dr. Miller. So what are we doing about
I know, it is a long time. But that's a really interesting point. I don't think that we really practice that on the regular with our kids before they had teeth, that they are eating soft foods, and that soft food still gets, the residue stays on their gums, which can still have the same effect, you know, like, you know, sugar or whatever, carbohydrates and all that stuff in your gums, and that can cause some issues as well.
Yeah. Certainly.
Interesting.
So 2 minutes does seem like an eternity. So I will tell you this, a few tips. So one, go with your kids to the store and pick out a fun toothbrush. Let them choose something that's going to speak to them. Maybe it's a favorite color, maybe it's a favorite character. The other thing now, there are some toothbrushes for kids that actually have sort of built-in timers.
Okay, we got that for my oldest. Our dentist recommended that we get her an electric toothbrush, and it has the timer on it, and it really has changed her teeth brushing.
Yes, and some even for the younger kids, they might play songs. I know for a lot of parents, the idea of singing the ABCs twice, that's another thing to sort of set for the time. So again, there are tips and ways to kind of make that time, that 2 minutes go by. But really, I think the key is modeling that good behavior. So your kids are watching you. So if you're brushing regularly, flossing, that's another piece.
Yeah, and how often? Twice a day as well with flossing?
So flossing at least once a day.
I floss once a day at night. I feel like that's okay, right? Maybe?
I think that's
all right, doing the best. Okay, now getting to the appointments, this is another thing. You really need to be consistent about going to the dentist. How do you recommend that parents do this? And I think just emphasizing the importance of it can make a big difference.
So you are right. And it's really important because a lot of people don't know when to start to go to the dentist.
Yeah.
So we know research has actually shown about 75% of parents don't know how soon they should start taking their kids to the dentist for the first time. So obviously when you have teeth, you certainly could start going to see the dentist right away. Although I will say a lot of parents are doing the well-child checks. And so oftentimes the pediatrician can help as well to keep an eye on oral health.
Okay.
For other families, getting to the dentist at least every 6 months.
Right.
You should be doing every 6 months, setting that habit early. Oftentimes, a lot of dentists, and especially family dentists or dentists for kids, will offer a sort of get-to-know-you visit. Maybe it's one where you go in, you check everything out. There are a lot of contraptions and bright lights and things for kids to get used to. And so oftentimes it's sort of a visit where you can practice. You can sit in a chair, see all the bright lights, listen to some of the instruments, and just kind of know what to expect.
Right.
Yeah, because it can be kind of scary for a lot of kids. There is like this weird misnomer, like myth thing that kids grow up not liking the dentist, and I have actually loved all of my experiences with the dentist. I think another tip for all the parents out there too is set your appointment before you even leave the dentist. If you're going every 6 months, don't leave and then like, oh no, I'll call back in and set the appointment. Just set the appointment right then and there for 6 months. Now, the other thing that I think is interesting is we have gotten so much more convenient with health. There is the opportunity for teledentistry as well. How does this work?
So it can work, and some dental plans do offer teledentistry. So you still have to go in for those routine cleanings, but sometimes accessing the dentist themselves can be a little bit more difficult for people. So when you're going in, you're getting those routine cleanings, but then sometimes the dentist might be available via telemedicine. So again, for people with routine care, that actually works really, really well.
Yeah, this is good advice, Dr. Miller. Thank you so much. Get in there. You got to brush those teeth.
I know. I should probably floss more.
Oh, man.
Shouldn't we all?
Yeah, flossing. Okay, you can learn more about health and wellness, all sorts of information on UHC's website. It's uhc.com.
And don't worry, we have a link posted for you on TwinCitiesLive.com.